Just a little about us. My name is Bryn Blackwood, and I'm a benefits consultant with Maximus Rose Living Benefits. And in case you're unaware of what we do, we are a group benefits insurance brokerage. We work with all of the major insurance firms across Canada, and we provide customized and tailored employee benefit solutions to employers, along with healthcare spending accounts, retirement plans, and individual insurance options. And this morning we're joined by our Dr. Allan Steingart of Psychotherapy Matters. And Dr. Steingart is the founder of Psychotherapy Matters. He has been in practice for over 30 years and believes that psychotherapy and collaborative care should be the first line of treatment for all mental health issues and available to everyone. And he loves psychiatry and has made some significant research contributions. And Dr. Steingart will be assisting with answering our questions during the Q&A, both questions that have been submitted already and questions that you can feel free to submit during session. And we're also joined by Andrew Carr of Dialogue.
Hey folks, I appreciate you having me on board today. I'm an account executive here with Dialogue. My accolades are nowhere near as prestigious as Dr. Steingart, so I'll tell you a little bit more about Dialogue instead. High level, Dialogue is a health tech organization which works exclusively with organizations to really help support the well-being of their members. We do that by providing them with a healthcare platform that has a variety of programs available to support employee physical and mental well-being. Today we have two programs. One is primary care, which is unlimited access to a team of doctors, nurses, nurse practitioners digitally. And then we have our stress management and mental well-being program, which is focused on end-to-end support. And really is what I will be introducing today, as it is in line with the discussion topic. So excited to chat with you folks today and appreciate you having me join.
Thanks, Andrew. Again, just a reminder, if you do have any questions, you can email me or submit anonymously at maximusrose.com. or message in the chat as well, messaging, selecting me as the viewer. So question one is about agoraphobia. So the question is, my father is 71 years old, and although he is in good health for his age, he's still at higher risk for COVID based on his age. Since the pandemic, he has become agoraphobic and has not been leaving his condo. He isn't even leaving for walks around the block. Is there anything I can do to encourage him to go outside? I don't think sitting in front of the TV all day is good for his mental or physical health.
Yeah. So if the person who asked this question is here, I'd be happy to hear more about the father. But this is, unfortunately, a common scenario right now. And it's part of what might be the second. We don't know yet whether we're going to have a mental health pandemic that coincides with the viral pandemic. But when people have anxiety, pre-existing anxiety disorders, then all of the public health measures have the potential to worsen their avoidance, their isolation, and their anxiety disorder. Now, this question is actually titled agoraphobia. So I thought I will just briefly talk about phobias, because if you look up phobias, and if you're into word games or Scrabble, it's a really great source of very long words that you can learn. And typically they are a Greek name for something attached to the word phobia. So agora refers to a public square or marketplace. And phobia refers to an irrational fear. The phobias belong in the category of anxiety disorders. These are conditions where there's excessive and difficult to manage levels of fear. So the first question is, should we even call this agoraphobia? Because actually we should all be agoraphobic right now. That's one of the public health measures. We shouldn't go into crowded places where people congregate, and that could be the cause of an outbreak or infection of the coronavirus. So the question with phobias revolves around whether the fear is rational or irrational. And now the lines of risk determination are unclear. So with a 71-year-old, it's not really phobic to say, I don't want to go into public squares that are crowded or marketplaces that are indoors. And then the question is, what are the risks? Let's suppose that your father doesn't have a pre-existing condition, because agoraphobia is also associated with other anxiety disorders, particularly panic disorder. So since the question isn't about panic disorder, I won't go into a whole discussion about that. But agoraphobia can be linked to other conditions. And if it is in your dad's case, we'd have to figure that out. Let's assume, though, it has to do with his compliance with the public health measures. Well, then it's a discussion about risks versus benefits. And I like the way you put the question, because you're saying, yes, if he stays indoors, he can protect himself against the virus. But if he stays indoors and is sedentary, then he's increasing the risk of cardiovascular disease and of depression, actually. In fact, activity and exercise is protective against most of the common mental health issues, including anxiety and depression. And a 71-year-old, or people who are seniors like me, do benefit from exercise, both mentally and physically. So how do you talk to your dad about the risks versus the benefit? And for sure, the benefits of going out and practicing the unfortunately named social distancing, but what is essentially physical distancing and mask wearing, is really necessary. If you can't convince your dad, then maybe engaging the family doctor in that discussion. Because if his avoidance is irrational, then we have to help him to deal with that fear. All anxiety disorders have in common avoidance. At the heart of anxiety disorders is avoidance. The treatment of anxiety disorders, the psychotherapy treatment, is almost always involved in helping people to avoid avoidance, or to face the things that they're afraid of. So determining exactly what your dad's afraid of and somehow compartmentalizing it into the things that really do involve risk and the things that are very low risk or practically no risk, having that discussion would be helpful. And looking, and like every risk-benefit decision, you'd have to look at the alternatives. So there are risks in not going out and not moving and not doing any kind of activity. Okay.
So my daughter is entering grade 9 and has social anxiety, and I'm afraid her anxiety will get worse since high school is partially online learning and kids are being encouraged to socially distance at school. How can I help her practice making friends and being social while social distancing?
Right. So this is another anxiety disorder question. And it's no wonder that it comes up because, as I mentioned, this is like the perfect storm for people who already have high levels of anxiety. Now, social anxiety is a particular kind of irrational fear or phobia. And I notice there's a definition on this slide. The features of social anxiety really have to do with a fear of judgment or of being criticized or of people's negative evaluation of you. And the first point I want to make is that virtual or video contact of the sort we're having right now is social. So in-person has tremendous benefits and it's preferred. And I'm guessing that when this is over, there may be a reaction against all video conferencing such that people will refuse to do it for months. I mean, everyone may be so sick of it by the end of this that they may actually say, we don't want to do this anymore. But in the meantime, you have to treat the video and the virtual as social. And so your daughter has lots of opportunities to be in social situations through video, through this kind of interactive video. That's why I wish we could unmute your mics and this would become more social rather than me just talking at you. If it's interactive, then it contains the ingredients of a social setting. But I'm going to try to imagine you, and I'm going to try to imagine your daughter. So there's a lot that she can do, even while compliant with public health measures. I'm going to introduce the idea.
Sorry, if I could interrupt you, Dr. Steingart. We have one caller who has called in and joined on the phone, and I'm not able to mute your microphone, and there's some background noise. If you don't mind just turning off your mic, muting, that would be really helpful. Thank you.
This is SB?
I believe so.
Oh, okay. Or maybe you have something to say.
That too.
Yes. So in terms of helping your daughter with social anxiety, I think that you can provide lots of social anxieties even within the virtual, lots of social experiences within the virtual space. And again, the rule, the cure for anxiety disorders, I've already taught you the mantra: avoid avoidance. After you determine whether it's an irrational fear, then all the treatments for phobias involve exposure. Exposure is avoiding avoidance. So it's very important for someone with a social anxiety disorder to have experiences talking to people, interacting with people, even experiencing judgment or criticism. Now, there's one feature of social anxiety disorder which is not sufficiently emphasized in its treatment. By the way, there are medications for anxiety disorders too, and I'm not going to talk about them right now because they should always be the second line or even third line of treatment. Because medications can become part of the strategy of avoidance. And what did I already tell you? What's the cure for an anxiety disorder? Maybe our panel can say it. What did I say?
Avoidance.
Avoidance, yes. If you remember that, you've learned a lot. If you remember what psychiatrists are and how great they are, how useful they are, and their unique training and role, and if you remember to avoid avoidance and apply that to your own irrational fears, then you can do a lot of good for yourself and for others. So one of the features of social anxiety disorder, if your daughter really has the full syndrome of social anxiety disorder, is that exposure by itself isn't enough. And what we've learned is that people with social anxiety, even if they have a lot of experiences that are successful, so for example, they're terrified of speaking in public, doing a presentation, and then they do a presentation and it goes really well. And everyone tells them they were amazing. They nailed it. It was a great presentation. You ask that person after and they'll tell you, I was sweating, I was shaking, it was terrible. People are just being nice. People don't want to be rude to me. They're not telling me the truth. So in other words, they take these exposure experiences and they devalue them or diminish them. So no change can occur. And as a result, exposure by itself has been shown to be, it's only partially effective. And one of the things that is used now in a modified form of cognitive behavioral therapy for social anxiety disorder is to make recordings of people in a social interaction, asking them to rate themselves on how they think they appeared, how they think they sounded, and then show them or review the video. So this can be done by a therapist trained in this model of psychotherapy.
Thank you.
You're welcome.
And our next question, so it's regarding depression.
Yes.
I'm having a hard time with my son. Like most other grade 12 students, he missed most of last semester in class, as well as high school graduation, prom, and summer celebrations for grade 12 students. He's doing his first semester of university online from home, missing out on living in residence since university is now just online, now just online learning until next semester, provided that there are no second wave shutdowns. He's become very pessimistic and I'm worried he's depressed. I tried to talk to him and be encouraging, but his outlook on life has become very negative. What can I do?
So, my heart really goes out to children and young people including teenagers and young adults, because they've been impacted in all sorts of ways that are quite unfair and not really directly related to the virus itself. Although they're not immune to the virus, and there's some children that have died or become very sick, in general, this is a big problem for older people like me, and less of a problem for their generation. And yet the consequences have been very dramatic in essentially shutting down their lives. And for many of them, they've had to put their lives on hold. So I think this is a really big problem. And some of your son's pessimism about the world right now isn't, again, it isn't entirely irrational, considering all of the events that are going on and the challenges that his generation is going to have to face and to fix. But I'm very optimistic about that generation. I really like them more than my own and the ones right after mine. So these Generation Zs, I think they're really great. And a little bit of realistic pessimism, I think, is okay. It grounds them. Now, having said that, I'm going to take this opportunity to differentiate between what we might call clinical depression, what a psychiatrist would diagnose, and existential depression, or the normal sadness and frustration as a result of life's unfairness and as a result of pain and loss. Because your son has already lost his prom, his graduation, his summer, and now he's going to lose the opportunity to go into residence and to start university and all of the excitement and experiences that go with that. So acknowledging that is a good place to start. But is he clinically depressed? And by clinical depression, we refer most commonly to a syndrome called major depression or major depressive disorder. So how would you know whether your son is just feeling bummed out, sad, low because things suck right now, or he's clinically depressed? And depression is an epidemic in young people that existed before the virus pandemic. We knew that there was an epidemic of depression in this generation. So the feature, it's very unfortunate that we named a syndrome after one of its symptoms, and believe it or not, you don't even have to have that symptom to have the syndrome of major depression. So I would vote for renaming the whole thing. But we've named it after one of the symptoms, which is a feeling of sadness or feeling low or feeling down. Now, I should emphasize, you actually don't have to have that symptom to be suffering from the syndrome of major depression. What are the other symptoms? Well, the other symptoms, which you can check with your son about, are difficulties with sleep, difficulties with appetite, either eating way too much or not eating at all, difficulties experiencing any pleasure or joy. I should mention that it's not just that the feeling of depression has something in common with what I'll call normal depression or sadness, but if you ask someone who's suffering from clinical depression, is it like normal sadness? They'll tell you no, it's not the same as just feeling sad, because it's persistent and it's pervasive. It doesn't lift, it doesn't react to stuff that, should make me feel better, even for a few minutes. So another feature is this lack of the ability to experience joy or happiness. And then there can be agitation or slowing down. There can be physical fatigue, lack of energy, can't even get out of bed. It's hard to get out of bed. And finally, there's the issue of suicide or thoughts about death. And that's on a spectrum from thinking the world would be better off if you were gone, or you don't matter, life is pointless, worthless, to actually having thoughts about ending your life, and finally having a plan, something you're going to do. Now, I'm just going to again emphasize something that you probably already know, which is that asking people about suicide doesn't increase their risk of suicide. So if you ask someone if they have thoughts about death or ending their life, that's an okay question to ask someone. It doesn't plant the idea in anybody's head. Most of us, all of us really are afraid of dying, and you want to encourage that. And many people who are depressed operate under the assumption that no one will care or that the world might be better off. And that's just not true, right? It's the most horrific loss imaginable. And telling people that can actually help them to manage their distress. So that's the syndrome of major depression. It can affect people at any age. If it's very severe, it can cause the person to just basically be in bed all day, not eating, not sleeping, not doing very much. And there's this big gray zone between, what would be a normal teenager's angst and, doing their own thing, and the syndrome of clinical depression. And I would say one of the big dividing lines is that they're not able to function at all. Nothing, like it's interfering with their functioning, and you're concerned about their safety, because safety would be a big problem. Now, in terms of helping a teenager, young adult who's in that situation, I'm just going to repeat the story about that. Virtual is social. Although the universities are maybe temporarily switching to no in-person or lecture hall classes, there are other places that they can interact with people or work as a volunteer. Now, I was just going to, the final comment I was going to make about this, because it applies to all three of these questions, is the idea of bubbles. So the public health measures have to do with making sure that outbreaks, if they occur, are limited, and protecting people who are at risk. Until we have really good therapeutics or we have a vaccine, we want to protect people who are at high risk. And there is a very clear risk stratification. The older you are, the more serious it is. So when it got into the nursing homes, a lot of people died because those were old people with coexisting diseases. So we know now that if you're any age and you've got hypertension, heart disease, kidney disease, then you're going to be at higher risk if you get this infection. So we have to put a bubble around those people. And it took us a while, for whatever reason, to get our act together on that. Similarly, you want to bubble the people in your life who are at risk, older people, like the 71-year-old father. But there are people who can move into the bubble, and you can begin to merge bubbles if people are all being very compliant with public health measures. And similarly, your son may not need to be protected to the same degree as the 71-year-old father, but he may need, if it's possible, to be separated from infecting other people who are at risk.